So the child needs to have a life-limiting illness. And usually that's something that your clinician would discuss with you, whether it's appropriate for you to be referred to palliative care. And also we want the parents to be in agreement. Sometimes parents have self-referred, and when we've had parents that self-referred, we will usually let the clinicians know, make sure that they're referral, and we're fine with parents self-referring. But having said that, apart from having a life-limiting illness, we want children who have an uncertain disease prognosis, whose disease is not responding to our therapies, and the child is getting well. And certainly sometimes we're doing more and more interventions in the effort of trying to improve a child's well-being, and we're just making a child sicker. And the child is spending more and more time in hospital. Probably that's the right time to start thinking, or should we be thinking of involving palliative care? If your child has difficult pain or any other difficult symptoms to manage, such as nausea, vomiting, or secretions, we can help with that. Acute deterioration associated with disease progression, if you need extra support, and also in terms of, I guess, having those difficult discussions. So what happens when a child is referred to us? So usually when your child is referred to us, what we want to do is identify who are your key support people. Do you have a GP? How involved is your GP in your child's care? Do you have a pediatrician? Who's your neurologist? And do we need to refer you to a primary community team? And who is the community team where you live? And we'll try and identify who that team is and how they can support you. What are your care needs? Do you have any symptoms? And we'll try and make sure we provide a management plan. Look at your medications. What medications are you on? Do you have an emergency plan? It might not be from us. It might be from your neurologist or your endocrinologist. Do you have all the necessary equipment to care for a child properly at home? On our team, we have a physiotherapist and an occupational therapist. They don't take over, but what they do is they meet every family and child and make sure that you have the right equipment, and they help advocate and communicate with an NDS provider, make sure that you have equipment provided in a timely fashion, and also as your child's illness changes, your equipment changes, and sometimes we could loan you that equipment from hospital whilst you're waiting for that to be provided. Look at transport, psychosocial support, and make sure that all that is documented and all that is communicated with all the other teams. Then we'll link you in with the community care, and we work alongside adult community palliative care to support our children at home because they are closer to home, and also we don't have the capacity to go out every day, but they have the capacity to go out every day if your child is very sick, and certainly if it's towards end of life as well. And also sometimes we, as I talked about, we transition patients, we can discharge patients, we talk about location of care. Every child in our service has access to Bear Cottage for a respite. And that's a location if you decide to be there at the end of your child's life as well. There are many benefits to referring to us early, I guess, because we know that it's extremely difficult to predict how long a child will live for, and also the impact of medical treatments. That's why it's important that we get referrals early. And also when we establish a good therapeutic and trusting relationship, we work better with families because we can advocate for you better, we can support you better because we know what your goals and wishes are. And referring to us does not mean that we are giving up. Like I've said, we work alongside treating teams. And at some point, if you're doing really well and we think a child has a need, sometimes we'll discharge patients, and we can, and if anything changes, we're happy for your child to be re-referred to us.